today?
Good. How are you?
Good. My name is Emmy. I'm going to be your nurse today.
Hey, Emmy.
Yeah. Can you just tell me your name and date of birth?
Jess Millett and 9/7/95.
Okay. Wonderful. So what brings you in today?
Just a well check
Okay.
visit. Yeah. That's my yearly physical.
Okay. Have you had any recent major complaints about your health, or how's your overall health been doing recently?
Yeah, it's been good. It's
Over a little bit.
I don't really have any issues. Just coping with life and stress levels. And
Yes, I know. Yeah, it's been a stressful season. I know with COVID right now, it's kind of brought everyone out of their normal routines and stuff. What do you do for work?
I'm a nurse.
Okay. What kind of setting do you work in?
Acute care, med-surg hospital.
So you're really seeing what's going on right now.
On the COVID unit, so.
Okay. Yeah. Yeah. Okay. So Jessica, you are 26 years old, correct? Okay. Just gonna go through. We're gonna get your vital signs here first. So really, would you say like stress? How's your stress been? Has that been like a major
It's pretty
thing?
good. I wouldn't say it's like a major concern, but I'm pretty good at tolerating my stress, taking time to rest and, refresh myself.
Yeah, that's important.
It's definitely, can be intense at times.
What do you find to do to cope with your stress?
I like to go on runs, and I definitely make sure to pray a lot throughout the day too.
That's wonderful.
Just eat healthy, take care of my body.
Good. How often do you exercise?
Every day, something.
What do you like to do for that?
Run or...
Oh, even in the cold?
Yeah, the cold doesn't stop us.
(98/58). Is that pretty normal for you?
Yeah.
You run a little bit low.
Yeah.
Okay. Does your family have any history of high blood pressure or anything like that?
No.
Okay. 98/58. I'm gonna take your temperature. Let me just scan that. Okay. 97.6. Good. I'm just gonna feel your pulse here. Pulse 62. Respirations are 14. Okay. You had any pain today?
No.
Okay. Looking for my chart. So we're just going to do a little bit of a head to toe today. Just looking over at your, overall general health. Okay. I'm just going to start by listening to your lungs and your heart a little bit, if that's okay.
Yeah.
I'm going to pull this curtain for privacy. Okay. Before that too, actually, maybe I'll ask you a few questions here. Are you on any medications?
Just vitamins.
Okay. What do you take, vitamin-wise?
Vitamin C, zinc, and D. Just for general health, and then I take vitamin E for circulation because I have Raynaud's and just.
Okay, I see that here.
Yeah.
Have you had any exacerbations with that recently?
Not anything bad at all. Just very minor. I think the vitamin E helps, so I just make sure to put my hands in
Good.
hot water, wear a lot of layers.
Yeah. I know, especially with it being cold out, that can be
Yeah.
a little bit tough. Do you like to do sports outside and
Yeah,
winter?
like skiing and
Okay.
snowboarding and ice skating sometimes.
and no allergies?
No.
Still? Okay, good. Just gonna quickly get a little past medical history, make sure I have things right here. No major things like from your childhood,
No.
medical wise. Now you have the Raynaud's. Any surgical history?
Just wisdom teeth.
Okay, wisdom teeth. When was that?
I think it was when I was 17, so math. Like 2011 maybe,
Okay.
or maybe more like 2013. I'm not quite sure.
Okay. And OBGYN, any past pregnancies that you've had or complications with that?
No,
Okay. Have you had your regular pap smear?
actually no. I should probably get that
Okay.
scheduled.
Yeah, that would be a good idea. And any psych history? Psychiatric, okay. And did you get your flu vaccine this year?
I did.
Okay. When was that?
It was like October, beginning of October.
Okay, good. And your tetanus?
Yeah, I had that about 4 years ago.
Good. So you're up to date with your vaccines. Any specific family history that would be good to be aware of? Any like family history of strokes or heart attack or anything like that?
No, but my mom has had melanoma.
Okay. When was that?
When she was like 28.
Okay. So yeah, it's a good idea just to do your regular skin
I go to my
mole
dermatologist.
assessments. Any
regularly.
abnormalities with moles?
No.
Okay. Yeah, just make sure to be watching them every month, make sure to look for any discoloration or abnormalities in like the shape and any, just different changes that you notice with that. Do you have any history of diabetes?
My cousin has type 1 diabetes.
Any cancer history?
No.
Any issues with kidneys?
No.
Stroke?
No.
TB?
No.
Renal disease or thyroid? Any alcoholism? Do you regularly drink alcohol?
I don't know, just social occasions.
Okay.
Like 1 glass of wine
Okay.
sometimes.
Every now and then.
Yeah.
Do you use any substances? Okay. And are you in any abusive kind of relationships right now?
No.
Okay. And any suicidal thoughts recently or okay, no. Okay, so were you born in this area?
Yeah.
Okay.
It's close by.
Okay. So you said you're a nurse. Did you have your bachelor's? Okay. And do you live at home? Do you live with your family?
Yeah, still with my family.
Okay. And you have no issues getting around?
No.
Okay, you have a car. Okay, drive. Insurance, do you have that? Okay. And English is your language. You said some of your hobbies probably are like exercising, eating healthy. Okay. Great. Okay, thanks for that information. And now we will get to just doing a little bit of a head to toe. So would you say your energy's been pretty good recently?
Yeah.
Okay. Any changes in your weight?
Not really.
Okay.
I think.
Good. I'm just gonna listen to your lungs just here. Just take some nice deep breaths. I'm just gonna pull this down for a minute.
Mhm.
Good. Just gonna listen to your heart. Okay, great. Would you just mind laying back a little bit for me? I'm just gonna listen to your bowel sounds. So your abdomen. Any issues with digestive health you've had?
No.
Good. When was your last bowel movement?
This morning.
How often do you have a bowel movement?
Once or twice a day.
Good. Okay. Just feel it. Sorry, my hands are a little cold. Any tenderness?
No.
Good. And any displacement or bulging? Okay. Do you do regular breast exams?
Yes.
Okay. Good. I'm just gonna take a look here at your feet. I'm just gonna take off your socks. Nice strong pulses.
Sorry, my toes are very in need of polishing.
It's okay. It's winter.
Didn't get my pedicure yet this week.
Any issues that you've been having with like bounce or that kind of thing? Okay. If you could just stand up for me and just walk across the room here. Any changes in your hearing?
No.
While you're standing, I'll just ask you to just close your eyes and just stand here for just a second. Just stand nice and straight. Good. No dizziness with that? Okay, great. Okay, and just sit down. Any swelling that you've noticed anywhere?
No.
Okay, I'm just gonna check back here. Any tenderness there?
No.
Good. Any like abnormalities that you notice with your skin? Any like different kind of growths or no pressure injuries or open wounds that
No.
you've had? Okay, good. How's your vision been?
Good.
Good.
I wear glasses for driving.
Okay, wear glasses for driving. I'm just gonna have you a little bit of an eye assessment. Just look straight ahead for me. Shed a little light in. Good. Okay, and now just look here straight with your eyes and just follow this with just your eyes, not your head. With your head. Good. And now just follow it with your eyes. Good. Okay, and smile for me. Raise your eyebrows. Good. Just look in your ears here. Good. Drainage. Okay, just open your mouth and say ah.
Ah.
Good. You regularly go to the dentist?
Mm-hmm.
Good. And just lift your head up a little bit for me. Had a lot of colds recently.
I did have the RSV a
Okay.
while ago, or a month ago.
Okay. But you recovered from that.
Mm-hmm.
no loss of smell or taste?
No,
You had
I got tested for COVID.
any dizziness or headaches?
No.
Okay. When was your last eye exam?
It was this past January, I think this year,
January for your eye exam.
2020.
And would you just mind reading something for me here? Can you read that?
The seed that fell on the beaten path represents the heart of the one who hears the message of the
Good.
kingdom realm.
Any dizziness with that or?
No.
Okay. Perfect. Okay. Can you just give me some squeezes in my hands? Good. And just apply pressure here. Good. Okay. Let's see. No nosebleeds recently.
No.
Okay. When was your last dental exam?
This past month.
Okay. So November.
Mm-hmm.
Dental. Okay. Almost done here. And you haven't noticed any like different discharge or lumps in your breast during your monthly assessment there? Okay, good. Important just to keep doing that. No trouble breathing. No chest pain recently. Okay, good. And let's see. Any issues with urinating? Okay, no blood in your urine recently, or abnormal discharge or smell. Foul smelling odors with urine. Okay, good.
Except for the asparagus.
Okay. Yes, that's for everyone, right? Are you on any birth control right now?
No.
Okay. Are you sexually active?
No.
Okay. When was your last period?
2 weeks ago.
Okay. Good. Any varicose veins that you've had? Okay. Any history of blood clots?
No.
Okay. Any like muscle or joint pain? I know you're probably lifting patients with work, right?
Yeah. Just soreness at times, but I don't think it's really from lifting as much as more just.
Where do you particularly feel it?
Upper back is
Upper
like
back.
at times.
Okay.
Yeah.
Okay. Any like depression or anxiety recently? Okay. Okay. I think that is all on my assessment. Just see here. Good. Your hair is beautiful. I'm just gonna feel a little bit. Any abnormalities you noticed with your head? Okay. Okay. I think that is all. Is there any questions that you have for me?
Did you need to get my height and weight or?
Actually, that would be a good idea if we got your height and weight. What was your most recent weight?
I think like 132.
Okay. We can go and if you just want to walk right over here. Back. Okay, so your weight was 120 and your height was
120. 120.
Didn't want to say 128.
128.
128. 128 and your height is 5'3".
5'4".
Okay, 5'4". Okay. I think that's all, Jessica. Thank you for coming in today.
Thanks,
Yes. Let me know if you have any questions about your health and, continuing. You're doing a great job taking care of your health. So just continue to do that.
Thanks.
Yeah.
Yeah, me too.
Yes. Okay. You have a good day.
Thank you. You too.